room to get the answers from Dr. Julie Kantor, a pediatric ER physician with Nicholas Children's Hospital. Nicole, take it away.
Thanks, Louie and Christy. Dr. Kantor, thank you for being with me. I want to first
My pleasure.
start out with, a lot of people saying that children can't really get the coronavirus. Is that true? And how does this virus specifically affect kids?
Well, first of all, it's not true. Children can get the coronavirus. We've had, children testing positive all over the country, as I'm sure that many of your viewers have heard. The difference is that for children, luckily, so far, we have seen that they are not as seriously affected as our older population. So in that case, the children so far have seemed to be very lucky.
Do you see the same symptoms, if they get the virus in children as you do in elderly patients?
Yes, the symptoms are the same. You have a low-grade fever, dry cough, sore throats. Sometimes they can have diarrhea. And ultimately, it is much more aggressive than the regular flu or a cold in that it affects their respiratory system and they can go into respiratory distress. And that's why we stress that if you start to have symptoms of shortness of breath or anything of the like, that you would obviously seek medical attention immediately.
So we have learned today that our youngest case in Florida is a 6-year-old boy. Can you talk to me a little bit about that?
So, again, just even though you're 6 years old, it doesn't mean that you are not susceptible to the virus. And this person needs to be monitored to make sure that their respiratory status is safe, maintaining their oxygen levels, the level of work that they are requiring to breathe and take short breaths. Not all patients that test positive for the COVID-19 would need to be hospitalized. If they're stable and good condition, they can be sent home and be quarantined with, of course, the explanation and the warning that should something change, should they take a turn for the worse, they would, of course, return to medical attention called the Department of Health and so on and so forth. So just like adults can be positive and not need hospitalization, the same goes for children.
Thank you, doctor. So many important tips for children and for parents.